I'm talking about patient-centered care, where we are talking about holistic care. But the holistic care, I know what is it, but how to do it. And through this one, we can talk about the three-stage assessments. The first one is the clinical assessment, that we need to have a problem list. And the second one, individual assessment. This individual assessment is to have an idea of the real reason of coming, the performance, the concern of the patients, and also the contextual assessment. This contextual assessment is to understand very well the environment of the patient. And during the individual assessment, I have a patient who come with an idea of death because her sister deceased in childbirth, and she's pregnant, and she come to deliver her baby. And it's difficult for her to follow all the instructions we give her. But during my individual assessment, I understand her problem, and I can help her very well. The contextual assessment, another patient I have is a pregnant woman also, but her husband have a lot of problem, bank loan, financial difficulties, conflicts at work with his boss, and then it's difficult to my patient to be managed because of the environment at home is not very well. And when I try to understand what's happened with them, we try to help them, to give them the idea, to give them an approach of solution. And finally, she delivered her baby also without a problem. The third one is collaboration, shared decision making. I have a patient, or she was scheduled for cesarean section, but the day of cesarean section, the day before, and the day of delivery the baby, she was absent. And my team were furious because of a problem of disruption. After listening to her, I understand that it's a problem of her companion. The companion is not available to be with her during the cesarean session. With family medicine, I understand that it's important for me to collaborate with patients, sharing decision-making, and I try to have to share with them the day of intervention, means of travel to come to the hospital, if they are ready, and we choose the day together. And patients now are happy to and like to come to see me, saying that Dr. Sofako will understand them more when they have a problem with them, according to their decision making. And I have, during our family medicine training also, we talk about family conference. It's a time to go to the community in a family and have a time with them to help them to be healed according to a disease. I have a psychosis in a teenager whose mother I follow up. They call me in the night around 11 p.m. I had gone to administered care, but I noticed that atmosphere was tense. I organized a few days later a family conference. We are able to diagnose this family's problem and come up with a solution. After that, a strong family bond were reestablished, as well as the teenagers' health. And I know now today that family conference also is also important to help to help my community, to go to the community and help them, not only for their disease. And this three-stage assessment helped me to understand that one patient comes to me, it's not a disease, but it's a whole person I will take care. And also, this family conference helped me to reorganize the department. We now had 1 day of consultation for patients with no major problem, and another day for chronically ills, like preeclampsia, hypertension and pregnancy, diabetes and pregnancy, sex, cell anemia and pregnancy. And during our training also, we have a contact program. And I participate in my contact program in CMC Volon, Christian Medical College. And this picture shows when I present on how family medicine changes my practice during my contact program 2. And here we have a time of sharing with CMC Volon team during my contact program 1. That is Dr. Vinosa, and others were the team of CMC Velour. Here we are in the hospital to go to practice for a child who is ill. You have a fever for a long time, but they don't found yet the cause of this fever, and we check it, and after that we share together with the parents. And here also during our contact program, that's for our time of practice. We visit also the Department of Family Medicine, low cost effective care units. Low cost effective care is one of the principles of family medicine. And then we visit this department who is giving a low cost effective care units. After that, we had to talk about our trip to Mango Hope Hospital. That's a 3 to 4 April 2024. The team was Dr. Peter Santos, Jean-Paul, our regional secretary, and I. Is far from Lomé, 5. Yes, and the purpose of this trip is to assess Mango Hospital as a potential base for Diploma of Family Medicine program. And we visit the hospital, who is far from Lomé, and the environment were interesting. We talked together with the team, the team who was there. And this trip to Mango Hope Hospital opened my eyes to serve more people in the remote area. Mango Hope Hospital is based in Muslim area and so far from Lomé. And I appreciate also the commitments and the dedication of the team to serve God through a quality medical practice, providing quality care to vulnerable and low-income population. And in this hospital, anyone who enter the hospital for treatments will be taken care of, whatever the pathology, even before asking for money, which is not the case in our public hospital. And we learn more through this trip and the time we spent together with our brothers, Santos and Peters. And here is we are on the way back to Lomé. Thank you very much.
Thanks so much, Sofako, and I'm so glad you were able to get together with Jean-Paul and bring us that presentation as well. And so Sofako is one of the 190 people from over 50 countries who've done the Diploma in Family Medicine. And as we launch it into French, he'll be playing a supportive role there in the future as well. That was one amazing road trip, I can tell you. Okay.